Welcome to EPG Pathshala. Subject Social Medicine and Community Health. The main paper is the National Health Programs and Policies, which we are discussing. And today we are going to discuss National Program on Occupational Diseases. The development team, headed by Principal Investigator Professor C.P. Mishra from IMS BHU, Dr. Taneja, Dr. Masti, Dr. Banerjee. Now, what are the learning objectives? Before we go into any program, we must know what are the learning objectives, because that is how we describe what the procedure is. Now, first of all, we must learn to describe the burden of the occupational diseases. Whatever subject we are discussing, we have to know, first of all, what the total burden is. In other words, how many cases are there which we will have to deal with either actively or in the background. Then second, to explain the common occupational diseases in India, to describe the National Program of Occupational Diseases. Now, what constitutes an occupational disease? Everybody is in some occupation or the other, no matter how small or big it is. It could be an electronic industry, it could be an iron industry, or it could be a cotton industry. And as a result of these working in such places and being exposed to the risk factors arising from the work, it is necessary to know what could be the occupational diseases which could be contracted as a result of work exposure. Recognition of the occupational origin of the disease at the individual level requires the establishment of a causal relationship between the disease and the exposure of the worker to certain hazardous agents at the workplace. This relationship is normally established on the basis of clinical and pathological data, occupational history, anamnesis, job analysis, identification, evaluation of occupational hazards, as well as exposure verification. And when the disease is clinically recognized, we have to find a causal link which is established between the disease when the disease is recognized as an occupational disease. And now this is very important. Like I said previously, wherever you are working at a regular place, first of all, we must know what type of work is constituted as in that particular place for that occupation. Now, at that level, it could be what are the influences? What does that individual have to face through in the 24 hours or in the 8-hour or in the 10-hour level at which he is working? It could be physical, it could be something in the atmosphere, and it could be something which is related to the food industry. In any case, we have to find whether the place is safe and the occupation is safe for the person to work in. And it is important to know, because if a person works happily, safely, comfortably in a place, then there would be no loss of work as well as of the economy of the country. Now, occupational diseases cause actually huge suffering and loss in the world of work. Not only that, this also causes a very big personal loss in the individual himself, and it leads finally into the family. Because if he is handicapped, say he is working in a machinery and he gets a handicap or he is injured, now that means he will be laid off work, he will be sitting at home. It is possible that the pay would be cut, and therefore the family would be to suffer. Yet occupational or work-related diseases remain largely invisible. So as such, it becomes even more important that both the employee and the employer must be absolutely alert as to what could the dangers be both visible as well as invisible at the place of work. Now, the nature of the occupational diseases is altering rapidly. It could be technological and social changes along with the global economic conditions. They are actually aggravating existing health hazards and creating new ones. Well-known occupational diseases such as pneumoconiosis remain widespread, while relatively new occupational diseases such as mental and musculoskeletal disorders are on the rise. Now, what is the burden of the occupational disease? Before we go actually into what happens to the individual while he is at work, it is important to know what the burden is on the country. Now, annually, it has been recorded and seen that annually, occupational accidents and work-related diseases may cause over 2.3 million fatalities, out of which 350,000 are caused by occupational accidents and close to 2 million by work-related diseases. Approximately 6,300 people die every day due to these causes. Occupational accidents kill nearly 1,000 people every day, and work-related diseases provoke the death of approximately 5,400 more individuals. Now, these work-related diseases could take some time to kill the person, but in any case, whose is the loss? The loss is for the family and the family members. Every 15 seconds, a worker dies from a work-related accident or disease. Every 15 seconds, 153 workers have a work-related accident. There were also 313 million non-fatal occupational accidents requiring at least 4 days of absence from work in 2010. Now, this is another problem which needs caring, because even if it is a minor accident, or it is a minor accident which occurs during the work at the workplace, he is going to take off. And as such, for those 4 days or 5 days or 6 days, whatever he takes leave, this is actually an economic loss to the country as well as to the firm as well as to the individual concerned. Now, the suffering caused by such accidents and illnesses to workers and their families is absolutely incalculable. In economic terms, the International Labour Organization has estimated that more than 4% of the world's annual GDP, gross domestic product, is lost as a consequence of occupational accidents and diseases. Now, the ILO also aims to create worldwide awareness of dimensions and consequences of work-related accidents, injuries, and diseases. Now, below you can actually see very nice pictures of the lung. Now, we were talking about pneumoconiosis, and pneumoconiosis is what? Pneumoconiosis from these factories which cause minute particles to be actually breathed in by the individuals concerned, causing these particles to settle in the lungs as minor dust, and soon, with effective working for over a long time, the healthy lung soon turns into a sick lung. And now you can see the picture of the lung suffering from pneumoconiosis. Now, what happens in pneumoconiosis? Because it is not only that the lung becomes, D-shaped and it becomes decolored, but as a result, the breathing capacity of the individual lessens. He starts to feel dyspneic. He feels tired, and as a result, the entire effect goes on his work. Now, this is important because again, this is going to economically affect both the individual, the workplace, and the country. Now, fatal accidents and diseases in 2011 were estimated to be about 14%, and fatal diseases 86%. Whether it is a fatal accident or a fatal disease, it is definitely going to be a burden both on the company, on the nation, as well as on the individual. About injuries, occupational disease injuries. It's also estimated that in India, 17 million occupational non-fatal injuries, that is 17% of the world, and 45,000 fatal injuries, that is 45% of the total deaths due to the occupational injuries in the world, occur every year, which is a very big figure. And out of this arise questions, what is the care which must be instituted in every factory, in every workplace? And before you go into this, definitely every workplace, every factory will have to be studied in order to find out which are the pitfalls in that particular work-related injuries. Out of 11 million cases of occupational diseases in the world, 1.9 million cases, that is 17%, are contributed by India, and out of 0.7 million deaths in the world, in fact, 0.12 is contributed again by India. And in India, out of a total of 1 million crore of rupees of GNP in the year 1999, occupational diseases caused a loss of nearly 7,000 crores. Now we can imagine, in order to save this money, what are the steps we will have to take to prevent its loss. Now, coming to, till now we have been discussing what is actually the data regarding the occupational diseases, the fatal accidents occurring in our country as vis-a-vis the world situation. Now, what are the major occupational illnesses in India? In India, the National Institute of Occupational Safety and Health, also known as the NIOSH, has developed a priority list of 10 leading work-related illnesses and injuries. 3 criteria were used to develop the list. One was the frequency of occurrence of the illness and injury, its severity in the individual cases, and its potential for prevention, which is very important. These are, in fact, the 3 strongholds of how to approach this particular problem. Occupational lung disease is the first on the list. The prevalence of occupational asthma varies from nearly 10% to nearly all of the workers in certain high-risk occupations. And NISOH considers occupational cancer to be the second leading work-related disease, followed by the cardiovascular diseases, disorders of reproduction, neurotoxicity, noise-induced hearing loss, dermatological and psychological disorders. Now, what were the major occupational diseases actually can be divided in following categories for better understanding. Now, this is a very beautiful chart which shows what are the influences of these major occupational diseases. Now, it could be occupational injuries, which is very sensible. Occupational lung diseases, people working in factories like wood manufacture, where the dust flows, cottons, or the coal mining industries, and occupation cancers. Now, from any one of these, if the person is in direct contact with all these chemicals or with a regular physical irritation to the skin or any part of the skin, cancers could occur. And besides, of course, the lung cancers, then occupational dermatosis. Now, this could occur, for example, in the work industry. If a person is continuously working with the hand and with the instruments, it is possible that because of certain minor injuries or irritation at the same place, dermatosis could occur, skin dermatosis could occur, and it would take a long time to heal unless protection is taken otherwise. Now, it could be occupational infections, very common. It could be either from the dyes, or if he is dealing with plants, or if he is dealing with bacteria. For example, people working in the laboratories, they are likely to get these infections. Or if they're very closely knit. Now, for example, people like weaving industry. Now, in a small room, there is a loom at which people are working. And for every loom, since these are closed rooms, the air is very dense. It is very warm. Plus, there are 3 or 4, there could be a crowd of people working. And as a result, intercurrent infections between each of these people could also occur. So, lung infections would be very common. Occupation, toxicology. Now, people working with dyes, or with drugs, or with plants. So, in these, I will be giving you some more examples slightly later on, but this is also very important. And most of all, we should not forget occupation with mental disorders. Now, in all these places, people are, when they come to work, they are tense throughout, and particularly if it is an attention-grabbing work, for example, in the diamond cutting factory, where you need absolute concentration, or in the agate factory, You need absolute concentration for working. It is these people who are at total mental stress and finally coming into mental disorders. And of course, others could be minor. Now, we have a very nice chart which shows occupational disorders could be grouped to etiological factors also. And I would like to comment on this. Now, occupational injuries. Ergonomic related injuries means they're working, could be physical injuries. Anywhere. This could happen anywhere in the wood cutting or in the road. People are making roads, they are digging. Now they could injure themselves. So these will all fall into these categories. Then chemical occupational factors where people have to now dust, gases, acid, alkali, fume workers, now vapors. Now these are available in practically all the physical occupations which are there, whether there are road workers, whether there are miners, whether they are working in the silicon factory or in the other factories, or they are working in the tobacco factory. So dust or the liquid and the acid, alkalis, fumes, anything. Now, physical occupational factors, noise, heat and cold, electromagnetic radiation. Now, for electromagnetic radiation and ionizing, these will come into places where people are working constantly with X-rays. So one has to be very careful about wearing those X-ray indicators which show how much a person is getting radiation. Now, extremes of temperature, for example, you're working in the iron ore manufacturing. There you have extreme heat where the iron ore is coming in, and if you move away from there, it could be the cold temperatures and extremes of pressure. Now, biological occupation factors could be insects, molds, viruses. These would actually come into those places where people are working in the agricultural industry, or one of the very famous examples, that is the tobacco industry. Now, tobacco, a word about this. Tobacco industry is actually, it came from America, but it has been found that a very good variety of tobacco is being grown in the area of Andhra Pradesh and Madhya Pradesh. Now, when the tobacco comes up and the leaves grow, the strange thing is that these leaves grow big and strong. And they have to be picked at a time early in the morning when they are actually wet with dew. Now, the strangest part is that one has to understand that when these dew pickers, if they don't take care with their hands, it is possible that the nicotine may be absorbed through the skin, causing nicotine poisoning in these people. So therefore, particular care has to be taken that their fingers are protected or they are wearing a raincoat wherein the nicotine is not absorbed through the skin. Now, a newest development as far as tobacco industry has come in, that is, people have advised wearing nicotine patches, which actually regulates the absorption of nicotine in such areas, the absorption of nicotine into the skin, so that it does not go above the toxic levels. Then the parasites and the protozoans, people working in laboratories or people working in pathological labs. That is where these can come in, or maybe parasites can also come in when you're working in the fields. So agricultural industry, and of course workplace stress. When people today, high level technos are working in technical places, and the stress is too much because there is a demand of continuous upkeep with the modern technology and pressure to submit their time, their task in place. Now, one of the most important industries is the newspaper industry, where people have to run, reporters have to run to get news in time, and collecting from the time of collection of news to the time when it can be relayed over the TV network or the radio network is a complete stressful activity. And psychosocial conditions, they come up slowly, but they are there. We cannot ignore them. Now, national occupational safety and health systems and programs. When we have talked so much about this, becomes important that we have to create a safe and a healthy working environment for all these workers at different places. So each country has to develop an effective national occupational safety and health system as a collaborative effort of the government and social partners. Such a system should consist of various elements, including legislation and compliance assurance mechanisms, as well as training and information network. The system needs to be continuously improved through the formulation and implementation of the national occupational safety and health programs as guided by their particular framework and recommendations which have been given. Now, taking few more examples. The National Program for Control and Treatment of Occupational Diseases, this was actually one of the main health components of the National Health Policy in 1983, and it became included in National Health Policy of 2002 because since the country was progressing, occupational hazards were coming up with the rise in the occupational factories and the occupational situations. But very little attention was paid to mitigate the effect of the occupational disease through the proper program. And Ministry of Health and Family Welfare launched a scheme entitled the National Program for Control and Treatment of Occupational Diseases in 98 and 99. And Ahmedabad was the NIOH. Ahmedabad, which is an ICMR section, has been identified as a nodal agency for the same because they conduct researches and they conduct actual working of the inputs and the outputs in order to be able to frame the safety rules. Now, many research projects have been proposed to be initiated by the government, and most important is the agate industry. Now, what is the agate industry? Agate industry is a very famous industry wherein these small stones, in fact, they are stones in the Khambat area of Gujarat. These stones are available in all different colors. And the most important, which has become a major industry today, is the polishing of these agate pieces, so that, and they are sent mostly abroad in order to be made into jewelry pieces. Now, agate is also used in the precision industry for balancing, because in the balancing machines, agate is also used. So that has to be also, and now all these have to be polished. Now, another small word about this before I go on to the next ones. The agate industry, although it's a very flourishing industry in the Khambat area of Gujarat, we must know that it is actually a small household industry. Many multiple household industries have come up, and every single house maybe will have about 5 to 6 people working in it in small rooms, polishing, and absolutely no care is taken as to the difficulties or to the which may arise as a result of these unprotected industries. Now, herein the other problems of women labor as well as child labor is also brought in, because when one person establishes a small unit, it is the whole family which joins together to form this. Now, the government is taking definitely some steps to legalize and to take important protections against this silicosis and tuberculosis, which is vastly prevalent in these areas. Occupational health programs of tobacco harvesters and their prevention. I have already mentioned a little bit earlier, but in Andhra Pradesh, which is the biggest growing region for tobacco, we have to take care right from the time when the harvesting starts, because that is the time when nicotine absorption takes place, or when it dries, then the smoke and the dust may affect the people. Hazardous process and so that way they could wear masks and prevention measures to keep themselves safe. Hazardous processes and chemicals, database generation, documentation, all these are very necessary in order to disseminate information so proper protection can be taken care of. Capacity building to promote research, education, training at the NIOH, and health risk assessment and development of intervention programs in cottage industries with high risk of silicosis, just as mentioned previously. Now, prevention and control of occupational health hazards amongst salt workers in the remote districts of Gujarat and Western Rajasthan. Now, this is another which is very important in the Kutch area where there are salt deserts. The salt has to be taken and it has to be made, it has to be refined into the salt which we are which we are taking in today. Plus, it has to be improved with the addition of iodine. Now, we see the NIOH at Ahmedabad, and this is a premier institute, and it was brought up under the Indian Council of Medical Research, under the Development of Health Research, Ministry of Health and Family Welfare, and this is mainly for the research in occupational health in the country. The National Institute of Occupational Health, Ahmedabad, was established by ICMR in 1966. And to cater to the local needs of the southern and the eastern regions, the institutes established 2 more regional centers at Bangalore and Calcutta. Now, the NIOH has been established, it was established with certain main objectives. And that is to promote, obviously, intensive research to evaluate the environmental stresses and factors at the workplace, to promote the highest quality of occupational health through fundamental and applied research, to develop control technologies and health programs through the basic and fundamental research, and to generate human resources in the field. But most of all, we have to take care that the people who work for us will be completely safe. Now, the institute functions as a WHO collaborative and reference center for the occupational health, and it has represented in many important functions of the Government of India, including the Ministry of Health and Family Welfare, Ministry of Labour, Ministry of Environment and Forests, Ministry of Agriculture, to generate data and to provide guidance and recommendations on issues related to occupational and environmental health. Now, when we talk of environment and forests, let us not forget the very important rubber factory. The rubber factories, and as a result of the people who are actually tapping the rubber trees daily, making rounds in the jungles, so they are exposed to many more factors apart from the fact that they collect the rubber and they take it to make the latex. So other occupational pressures also come in. And most important is that I would like to mention here also that lung cancers, we have been talking, and lung cancers have been definitely a end product of the coal industries and the miners, the wood or the furniture making factories, and the cotton industry. Maharashtra, Chota Nagpur area, these are the cotton growing areas, and people picking on these cottons are definitely subject to the dust particles which come in and the cotton particles, which eventually may lead to lung infections, and eventually they may definitely lead to lung cancers also. Now, what is the vision of these? The vision is to create a safe work environment through intensive research and technology development and knowledge dissemination of quality support system in order to improve the health and well-being of the workers. Now, what is the global strategy for occupational health? This is not a problem of our country only. It is a problem of global importance. And it is not only that we are talking about our country, we are talking about the entire world, wherein different types of industries are being carried out, and as a result, different pictures are emerging of the occupational diseases, and as such, the preventive measures to be taken will have to be studied and forthwith and placed there. So we need strengthening of international and national policies for health at work and development of the policy tools, developing a healthy work environment, because at some places we have seen that people have relaxing hours, or they may create a gym. Today's high-tech offices are creating coffee places, or they are creating gym places wherein for 10-20 minutes the people who are working may get out from their high pressure areas and go and work there and relax themselves both in mind, or they may go into yoga. Yoga is a good replacement for a healthy mind and a healthy body. Then developing healthy work practices and promoting health at work. Now this is what it means. You create an environment wherein the person will be completely relaxed, tension free, and he works so that once he is tension free, the safety of his health will be at the peak. Strengthening occupational health services, establishing support services for the occupational health. Now, for support services, what type? For example, if there is an occupation wherein it is possible that people need continuous care, so they may call in a field of technical experts from the nursing so that they could be examined in time and checked for any problems, or for early detection of problems, and thereby take a proper stand. Then developing occupational health hazards based on scientific risk assessment, developing human resources for occupational health, establishing a registration and data system, including development of information services through experts, effective transmission of data, raising public health awareness, and of course, most important, we must strengthen research and develop a collaborative with the occupational services. Now, what is the present scenario? Currently, the National Program of Occupational Diseases is yet to be fully implemented through the country. And it is important to know that what are still the pitfalls as far as where are we with regard to this national program. Are all the programs or all the industries, have they been studied? Have all the issues been taken into consideration? And have all the proper methods been taken to prevent for early detection of these places? The program is not a priority for the states and does not have any separate organization, but program officers at the state and district levels, hence the program lacks implementation at the grassroots level. There is need to strengthen the activities of the program at all levels by ensuring the participation of the appropriate authorities. Now, in summary, let us summarize. It's also estimated that in India, 17 million occupational non-fatal injuries and 45,000 fatal injuries are occurring every year. And effective stand has to be taken for preventive, promotive, and curative services, including positive mental health and positive physical health. The Ministry of Health and Family Welfare, the Government of India, has launched the National Program for Control and Treatment of Occupational Diseases in 1998-99. The NIOH is also the nodal agency for the implementation of the program. Occupational lung disease, occupational cancer, followed by cardiovascular diseases, disorders of reproduction, neurotoxicity, noise-induced hearing loss, dermatological conditions, and psychological disorders are the main occupational diseases. As far as cardiovascular diseases are concerned, wherein people are working in the offices mostly without any activity, it is possible that those people, because of the severe mental tension and the stress which they are going through, could increase the blood pressure and thereby the cardiovascular diseases. Disorders of reproduction, those people who are working in the radioactive areas or in the hospitals or in the laboratories could, unless if proper care is taken, there could be some problem as far as reproduction. Neurotoxicity or the noise-induced hearing loss. Now, people working in factories where there is a large noise because of the machines, or they are working now. For example, small-scale industries are coming up by the roadside, and we hear a lot of noise, and still the people are working there. Definitely, there is some amount of hearing loss which will occur over a long term. Dermatological conditions in any factory, wherever the skin is coming in contact or in regular abrasion or with regular irritation, these conditions will occur. And psychological disorders are most important and amongst the most rising disorders today because of the extreme mental tension which our people are undergoing. So for these, India has to take steps. India has to promote uh, proper preventive, proper curative, proper rehabilitative measures so that both India and our people remain safe. Thank you for visiting us today.